Funny story. When I was a kid, I was very scared of police, as our parents would always frighten us with police if we were misbehaving. So for the longest of time, I wanted to be a policeman because I wouldn't go to jail. And my aunt said to me, "No, be a doctor, you'll never die." And I think that's where the dream kind of began. I thought it would be easy. I thought I would have a lot of money. In reality, being a doctor is a lot of hard work. It's a lot of pressure, a lot of responsibility, and it is a privilege. I moved on to do my ComServe at a community health center in Tanzania. When the pandemic started, I was the main person, working in the COVID side. There was a time when we did not have enough testing kits. There was a time where we did not have enough staff. When the waves got worse and people started dying, we ran out of oxygen. At the peak of our resources, we could probably have 10 people on oxygen. There was a time we had a very sickly patient who was brought in while I was seeing another patient, right? And as she was being wheeled past, I kind of saw that she looked a little bit floppy. So I just excused myself from the patient I was seeing, and I just went to go attend to it, and I asked him to please just put up a line and check the oxygen saturations on her, and she had very, very low oxygen saturations. See that she was perimortem. Put her in a private space. We did everything. I tried to get put on an oxygen mask on her, got an oxygen cylinder, opened it, was empty. Threw it out, got another one, it was empty. Threw it out, got another one, it was empty. So I told one of the nurses that I was working with, please run to casualty to get an oxygen cylinder. For which he did. He ran very quickly and came back. But by the time he came back, it was too late. And, that was the only time I ever lost it as a doctor. I had a breakdown. Yeah, that wasn't a good day. Then I got to a point where I got seriously burnt out. I was very apathetic to my patients, to my job. I was just doing it, and I didn't feel like I had the chance to take a break. The burnout is starting to lead to anxiety, starting to lead to depressive symptoms. But you put your patients first. You took an oath, right? I did find a coping mechanism, which wasn't necessarily a great one. Somewhere during the lockdowns, the stages, they did permit us to buy alcohol. I think that's what helped me cope. It wasn't healthy. I continued going to work until I got sick. I got COVID. COVID at the time was still a very deadly disease, and it came with a lot of fears and a lot of concerns and stresses. But also I felt, at least get to just get to sleep, get to do nothing. The Healthcare Workers Care Network, which kind of sprung up to give support to healthcare workers who were going through a lot during COVID. And I reached out to them, and I had virtual therapy sessions with them, and that helped me a lot. The first step of getting help is that you need to recognize that you have a problem. And I think a lot of doctors, we don't recognize what we're going through as a problem because everybody goes through it, and most people seem to cope with it. And the important word is seem. You are afraid that you will be deemed incompetent or not good enough. Why are you struggling? Look, we're all going through the same thing. Everyone seems to be fine. Everyone's coming to work. Everyone is productive. And you, why are you struggling? We are creating a generation of doctors that will be traumatized and estranged from family in the future, because you just haven't dealt with what you're going through. We need to normalize going to therapy. We need to normalize talking about our problems. We need to let go of macho Hercules mentality. We need to choose ourselves first so that we can be able to choose our patients.